Welcome, welcome everyone. Welcome Honorable John Briceño, Prime Minister of Belize, Minister of Finance, Economic Development and Investment. Honorable Michelle Chibat, Minister of Health and Wellness. Honorable Karim Musa, Minister of Home Affairs and New Growth Industries. Honorable Anthony Mahler, Minister of Tourism and Diaspora Relations. Honorable Dolores Balderramas Garcia, Minister of Human Development, Families and Indigenous Groups. Dr. Daisy Mendes, Chief Executive Officer of Ministry of Health and Wellness. Our partners, PAHO, Dr. Doreen Jack and team, UNICEF, BTL, Mr. Mark Lizarraga, Ambassador of Taiwan to Belize, His Excellency David Quan Chow, Ambassador of Panama to Belize, Her Excellency Marta Boza, Ambassador of Mexico to Belize, Her Excellency Marta Rivas, the Council of Guatemala to Belize, Bayron Morales, from the U.S. Embassy, the Acting Deputy Chief of Mission, Andrea de Armont, invited guests and members of the media, welcome to the official launch of the Belize COVID-19 vaccine campaign. My name is Renata Samuels. I will be your mistress of ceremony. But before we even get into anything, we must, of course, start with our national anthem. So I ask that we kindly stand, please, and feel free to sing along and let us hear your beautiful voices. To thy liberty, where tyrants and linger, despots must flee this shrine, where heaven democracy, the blood of our stars which hallows the sun, brought freedom, save the oppressions from, by the might of truth and the grace of God. No longer shall we be rulers of wrath. You can be seated. Thank you so much for your participation. Beautiful voices, beautiful voices. And we'll go right into it with our opening remarks, which will be presented by Honorable Michelle Chibat, Minister of Health and Wellness. Feel free to sanitize just before you start. You know, we're keeping very safe here. Even before we start, everything must be sanitized.
Mistress of Ceremony, thank you very much. Honorable John Briceño, Prime Minister of Belize, Honorable Anthony Marler, Honorable Karim Musa, Honorable Dolores Valderramos Garcia, CEO Daisy Mendez, members of the Diplomatic Corps, Dr. Jack, welcome. Ladies and gentlemen, good afternoon. Welcome to this press conference and launch of our vaccination campaign. As of yesterday, June 29, 2021, we have recorded 234 active cases in our country. Yesterday, we recorded 38 new positive COVID cases. We have 5 active hospitalizations and 1 ICU admission. The Ministry of Health and Wellness is concerned by the rapid increase in positive cases we have been recording since the 21st of June. We continue to witness a wanton disregard for the public health measures that have been implemented. We see videos of massive wakes and funerals taking place, bars which hide under the disguise of selling food turning into nightclubs, overcrowded public transportation and places of worship filled to capacity without adherence to public health measures. Furthermore, based on analysis done by the Central Medical Lab commencing on Friday last week, we're able to say that a variant of the COVID virus has now been detected in Belize. 2 sets of samples were run. 20 out of a set of 35 detected a variant of concern, and 22 out of 47 in the second sample run detected a variant of concern. At this time, we do not know exactly which variant it is. Our samples have been sent to Baylor College for gene sequencing to assist us in identifying the variant. We hope to have that information shortly. As defined by the CDC, a variant is one for which there is evidence of an increase in transmissibility, more severe disease, significant reduction in neutralization by antibodies generated during previous infection or vaccination, reduced effectiveness of treatment or vaccine, or diagnostic detection failures. As a consequence of the rising numbers and in an effort to contain the current spread, Minister Musa will be announcing the new measures which shall come into effect on Sunday, the 4th of July. Ladies and gentlemen, this takes me to my second point, which is that of vaccinations. As of today, all persons 18 years and above are now eligible to be vaccinated. All of our public health facilities are open to vaccinate persons 18 years and above. As well, all those persons who received a first dose at least 8 weeks ago can also proceed to get their second dose. When we first started our vaccination campaign, we were forced to follow a phased approach because of the availability of the vaccines. We had to reserve what we had available for our frontline workers and most vulnerable members of our population. And we had to ensure that we had second doses for those who became eligible. You will recall that we received our first 1,000 doses from Barbados on the 2nd of March, followed by 25,000 doses from India, 33,600 doses from the COVAX facility, followed by 10,000 doses of Sinopharm, and then we received 33,600 doses as a second shipment through the COVAX facility. Our most recent shipment came through the kind courtesy of the government and people of Mexico, who donated 100,000 doses. Ladies and gentlemen, we have in the pipeline awaiting delivery 138 doses from the COVAX facility and 112,634 from the African Medical Supplies platform. On June 18, we had given a total of 95,248 doses. As of yesterday, we have now given a total of 112,722 vaccines. 83,507 are first doses, while 29,215 are fully vaccinated individuals. I continue to encourage everyone to come out and get vaccinated. July is the month for everyone to get vaccinated. It is now your turn. Today, the Ministry of Health and Wellness is launching our vaccination rollout plan under the theme, Before you relax, get vaxxed. Vaccinations remain key to saving lives and the full reopening of our economy. In this regard, I want to thank our several partners who have assisted us to reach where we are today, including PAHO, UNICEF, the European Union, Rotary, Belize Tourist Board, BTL, and the Red Cross, and all of those diplomatic missions who have assisted in either getting vaccines into country, provided cold storage, and who are assisting with promoting the vaccines. This requires teamwork. It requires all of us working together to achieve the common objective of a safer Belize for everyone. Ladies and gentlemen, I wish to remind you that testing is ongoing and at all of our public health facilities. If you have minor symptoms, please go and get tested. It is important for you to know your status. Additionally, please continue to adhere to the public health measures. Wear your mask, wash your hands, and keep your distance. Finally, again, I wish to repeat, vaccinations are now available for everyone 18 years and older. There are no barriers to getting vaccinated. The only way we can get back to the semblance of a normal life is by getting vaccinated. For the love of self, love of family, love of country, get vaccinated. Thank you very much.
Thank you, Minister. And I just want to ask a question. Who here has gotten their vaccination, at least the first dose? Let's raise hands so we can see who are all supporting. If you have not gotten your vaccination, before you relax, get vaxxed. So we're putting it into effect. An excellent point. Once you're 18 and over, it is now the time to go and get your first shot if you have not done it before. I believe in this crowd, most people are 18 and over, right? We have some young faces, but I'm sure we're still on that 18 dot, right? 18, we're good, we're good. You're 18, yes. Doctor? Yes. Okay, great. And as I talk to the doc, Dr. Daisy Mendez is up next, and she'll be giving us a presentation. So, on the vaccine campaign. So please, round of applause. Let's have some life, guys. Let's have some life. Oh,
thank you. Thank you, Mistress of Ceremony. Yeah. Honorable Prime Minister John Briceño, Honorable Ministers of Government, Diplomatic Corps, and distinguished guests, on behalf of the Ministry of Health and Wellness, and on behalf of the team who have dedicated day and night to preparing and planning today's event and the campaign in general, I extend a warm welcome to each and every one of you. Thank you for being here with us today. As you may see, I get the exciting part of today. Other than Minister launching the official opening of the vaccination campaign, I get to share with the country what the campaign consists of and what are all the activities that we will be sharing with all of you. Before you relax, get vaxxed, Belize. And that's what you're going to be hearing. Not only the relax for us to socialize or for us to live the regular lifestyle that we used to think we had, but for us to also contribute to the love of country and the country's economy. But before I actually go into detail as to what the campaign is about, there are 3 things that I wanted to share with you, 3 notes that I want you to take home today. When we think about getting relaxed and when we think about getting vaxxed, these are the things that we also need to consider. Point number 1, like in every vaccine, we are increasing our body's immunity. COVID-19 vaccine is no different than the other vaccines that we have received in our lifetime. It increases our immunity. Getting the vaccine does not mean that you cannot contract the virus. Getting the vaccine does not mean that there is no way you can be exposed and not be infected. It means that you decrease the possibility of risks, complications, and severity that comes with the natural evolution of the virus itself. So if you're thinking about it not allowing you to be infected, think about the complications that you're saving yourself from. Also, getting vaccinated doesn't mean that you will ignore and forget the practices and public health practices and measures that have already been put in place. Wearing your mask, washing your hands, and practicing physical distance. What are the objectives and where are we heading when it comes in the intention of having a campaign? There are 3 things that we want to look for. 1, to increase knowledge. We need to know, we need to stop listening to all the noise and focus on what's happening in our country. We need to have our answers and myths and misinformation answered. We need to expose these questions and be guided by the experts, allowing you to know what the vaccine is about, allowing you to know how the vaccine will react and how important it is for you. Encourage the full vaccination, meaning completing your schedule of 2 doses, not staying with only 1 dose and think that that's it. Depending on the vaccine that you receive, which at this time we only have the ones that require 2 doses, please complete your schedule. Comply with the dates given to you of 8 to 12 weeks. And thirdly, attain COVID-19 vaccination coverage of up to 70% of the population, and as how it has officially been launched, in the population 18 years and older. What are we targeting? What is it that we also need to improve? How are we going to do this? Very key is public awareness and education, increasing the knowledge and answering those questions. It doesn't only include the education of what the vaccine is about, but also the proper way of wearing your mask, the proper way of disposing, the proper way of complying to the public health measures that have been put in place. Build the trust through education, having this contact with our team and the technical experts at the Ministry of Health, understanding and gaining the confidence to be vaccinated. And of course, once we have accomplished this, we will have an increase in our vaccination coverage of 70% or even more. And I believe we can go even more than the 70%. What are specific actions that will be taking place and as part of the plan that will be happening countrywide? And I want to say countrywide, it will be happening at the same time. Okay? What will be happening in Corozal in one day will be happening throughout the country at the same time. So through health education, we're not only focusing only on the vaccine itself, but also promoting the use of masks, the use of sanitizers, the use of the proper hand washing, and the disposal of the same, which is very important. Okay, expanding and creating access to testing. It's no longer you coming to the hospital, it's us coming to you in the communities. You can no longer have the excuse to say, I live in a community that's very far. We are going to be there once you have the symptoms, once you've been in contact with somebody who has been diagnosed positive. Access to testing, PCR testing, and rapid testing. And by doing all these actions, we are confident that with your participation, we will comply to our 70% coverage. Specific activities that we will be doing, other than the health education and awareness, is the distribution of masks and the distribution of sanitizers that will be happening countrywide, not only in the urban setting, but also in the communities and rural setting. Secondly, testing. We are bringing, through the assistance of mobile teams that will be moving in all the rural areas and urban areas to promote testing, to educate on the process. It's about not creating a fear to be tested. Please, it's educating, understanding the process, the importance and the need to be tested timely. It's free. This is given to you freely, including the vaccines. So once you've been tested and once you're eligible to get the vaccine, we are here. We will bring it to you. The communications team, along with the vaccination mobile team, will be coming to your area to vaccinate. And the best part of it is that persons who get vaccinated in the month of July get a chance to win a prize. How else can that get better? You know, thinking about it, I should have waited. But I guess we had to set the example and do it before the prize. So these are some of the campaign materials that you'll be seeing in bumper stickers and billboards. Before you relax, get vax. We need to have the acknowledge our frontline workers who have passionately dedicated their time, their efforts, and their passion in nursing and medicine to be a part of the response. So this is a reminder that we thank them daily for the work and the effort that they place into the system. And this is the common one because you've all been vaccinated, so you have seen this. So this will continue to be circulating in our billboards and bumper stickers. And stay smart. We are smart people. We will stay apart. And here's a little one that it may seem a little bit impacting, but it's true. If we don't take care of ourselves, these are where the complications, and this is where we can go. I mean, we need to put our part, and it's unfortunate that sometimes we need to provide that reminder that by us not doing our individual part into improving our own and the responsibility of our health, then unfortunately this is where we can have the risk of ending. And the exciting part with the vaccines is that with the partnership and sponsorship of BTB, you get to have the opportunity of a staycation. Who doesn't want that? But of course, your staycation and your relaxing comes after you've been vaccinated. Thank you. And with the sponsorship and support of BTL, we also have another opportunity for raffle. And fortunate enough too, BTL is not conducting a raffle only in urban settings. We are taking this in the rural setting also. So wherever the mobile clinic is, there is also the opportunity for these persons living in the communities to get a chance to win. So it's not only focused and centered in one area only.
Yes, hello. Good afternoon, everybody. My name is T.R. Shine, and I have been appointed to do a vaccine song, right, guys? So please enjoy with me. Let's go. Greetings, Prime Minister, ministers, respect. Let's go, bro. Must vaccinate ourselves. Here we go. Hey, this is a serious virus. Watch you now. I can't wait for the stage show to come. Can't wait for the dance again. Can't wait for back to normal again. Yeah, it's a problem everywhere. One thing where everybody share. No more recreating out there. It kills so much people this year. Got me max on me mask on me face out here. So much faces out there this year. It's a serious thing with corona and not talking the Mexican beer. And us the 2020s we here. But now we have to make a new gear. Everybody there out there with fear. Corona blow up like a nuclear. Don't cough, don't sneeze when people is near and spread the virus in the atmosphere. This is started in China, but everywhere. Say we tired of this corona. Yeah, say we tired of this corona. Get vaccinated and done. We want to party epic. From Monday to Sunday, do it all over again. And back to normal Monday. 1 case, 2 case, corona all in your face. I know 1 case, 2 case. Get your vax before it's too late. I know 1 case, 2 case. Corona all in your face, you know. 1 case, 2 case. Put your mask on your face, you know. If you start dry coughing up, sneezing and your nose running down, that's the sign that the corona come. Because whether or not you're interested, doctor said to get tested. It could be community spread or it could be a cluster. If you feel it beating in your head and you're not feeling too well, you're dead, they call for your bed. It could be the corona because I get vaxxed, you got to wait for the dance again. Can't wait for back to normal again. Now we go, hey. Yes, we tired of this corona. Get vaccinated and done. We want to party epic. From Monday to Sunday, do it all over again. And back to normal Monday. Whoa, yeah, 1 case, 2 case, corona all in you. 1 case, 2 case, get vaxxed before it's too late, you know. 1 case, 2 case, corona all in your face. 1 case, 2 case, put your mask on your face, you know. Yeah, thank you very much.
Thank you. I thought I got the fun part, but now I realize that was better. Thank you. Belize, this is the official jingle for our campaign, vaccination campaign. This is also the official ad that you will be seeing during this period of the campaign as we're promoting, if you want to relax, get vaxxed. All right, so thank you very much for that. And before I really close off, I'd like to acknowledge that 2 things, the sponsorship and partnership of other agencies. Also, for us to accomplish what we are looking for of our 70% coverage, we need you. We need you to be responsible for your health. We are bringing this to you. We are offering this to you for free. It is your right. So please, you do your part. The partners that I must acknowledge is the European Union, the Pan American Health Organization, Belize Telemedia Limited, and the Belize Tourism Board. Thank you so much. And I must also say, I must share the enthusiasm that the Minister was able to officially announce this morning that all phases are open for vaccine. I'd like to mark off again and emphasize 18-year-olds, come out and get vaxxed. Thank you very much.
Thank you so much, Dr. Daisy. We give him a round of applause, guys. We had a performance, we had a presentation. This launch is fun. It's not only information, guys. It's dancing. You know, we get everything in here. And so I think maybe we can do a goal to push that we get 70% of the population. I think that should be one of our goals. We should make that in our mind, the thing that we're working towards, right? Because before you relax, get vaxxed. And right now, we have Honorable Anthony Mahler, who is the Minister of Tourism and Diaspora Relations, and he will come and give some remarks. So, round of applause, please.
I have to do my part too,
You
right?
have to sanitize. We're showing everybody before you relax to get vaxxed, and you also have to sanitize.
Next time you have to bring a spray thing like this,
Spray
right?
time. Is Minister, we here next time? Yes. Spray bottles.
So good afternoon, everybody at the health table here. Good afternoon, everybody in the audience and media and people. This is live, right? People living,
Everyone.
listening, listening in
Living and listening.
yeah, living and listening in their homes. You may ask why the Minister of Tourism is up here today. I don't have to talk about any legislation being passed or any enforcement of it, but to date, we've done well in managing this virus. That has given us an opportunity to tell the world that Belize is safe and Belize is ready for tourism. So I'd like to thank all the frontline people, the Ministry of Health, the Police Department, the BDF, everybody that have done their part, who have done their part to ensure that we are safe and that we're again ready for tourism. In fact, just a few weeks ago, the CDC assigned a level 1 for us in terms of their travel advisory, which makes us one of the safest destinations in the world. That allows us to push hard, and my team here from the marketing department at the BTB can tell you that we've used this as a part of our marketing campaign to advise people and to educate people, to tell them how safe Belize is. And in fact, the experts were saying that tourism would rebound in a year and a half, 2, maybe even 3. But I'm pleased to say that today in May, we saw 70% of arrivals in May when you compare it to pre-COVID levels. And June is trending towards 80 to 82%. Now, and that is even without all the airline capacity that we expect to have. So Southwest isn't back as yet. They're coming later on this year. We have just signed up with Alaska Airlines, which is going to put a new route into Seattle and 4 flights from LA per week. And we have WestJet that is coming back later on this year, and Air Canada hopefully early next year, and some other airlines that we're dealing with out of Europe and in the United States should be next year. So by the end of this year, early next year, we should be at about 110%, 115% of pre-COVID levels in terms of airline arrivals or airline capacity. We've just opened the borders and we see that trending upwards. We had projected 8 to 9 months before it started to really take off. Just like the airport, it took almost 8 months for us to be here today. And the last thing we want is for these numbers to go up. 234 active cases as of today, 34 new cases just yesterday. We have to do our part as citizens. We have to be responsible. I know it is difficult. I know it's tiring to wear masks, to be limited to certain activities that you're used to. But it is critical. It is critical because our economy depends on it. And for us, there's just too much poverty right now, too much unemployment, too much underemployment. And if, like I said this morning on Open Your Eyes, if you want that free education, if you want improved healthcare, if you want housing, if you want better infrastructure, then do your part, do the responsible thing and go get vaccinated. That is the only way we can open up the economy. As a government, we don't want to prohibit anybody from doing what they want to do, but these are difficult times around the world. And like I said, we have to be seriously responsible. We want to continue to build tourism. We want to continue to grow the economy. But every single Belizean has to do his or her part. Again, I want to thank the Minister of Health. In fact, I want to thank the Prime Minister, who had allocated 8,000 vaccines for tourism frontline workers. And I want to thank all those people who work in the tourism industry who have gone out and gotten vaccinated. We're at about 80% of the numbers. And so you've done your part. And with the new arrangement where everybody over 18 can get it, I believe a lot more people. So we want to reach that 70%. And we want to continue to signal to the world that we're ready and that we're open for business. So thank you all for coming today. And before you relax, big up TR Shine. He's a Pixac voter, you know. So have a good evening.
Minister is securing that vote next time around already. Waste no time, but he's right. Do your part. Before you relax, get vaxxed. And religions like to say, we like free thing. The thing is free. It costs you nothing but a little bit of time to go in. So please, we want to get to that 70%. And I know you saw the slogan that said, be smart, stay apart. So we have next up Honorable Kareem Musa, Minister of Home Affairs and New Growth Industries, and he'll be talking a lot about how we're going to stay apart soon enough.
Good afternoon, Prime Minister, Honorable John Briceño, members of the head table, Mistress of Ceremonies. I beg your permission, I don't see the Commissioner here, but I'm begging permission not to wear my mask just while I speak. So in case you see the Commissioner, let me know so I can put it back on. Good afternoon, everybody, members of the press. That was an amazing song by TR Shine. Is there a possibility of getting a third shot? Because I feel like I need an extra shot after that song. Definitely a booster. So they've asked me to come and bring some bad news to a very hype event. So, but we have to look at it a little differently, I believe. Today we have the Ministry of Health relaunching a very exciting opportunity that many countries wish they had, and that is the opportunity to get vaccinated, one and all over 18 years old. So that is an exciting opportunity, and I want to encourage all Belizeans to seize this opportunity. So many people across the world would love to come to Belize just to be able to receive this vaccination. And so it's important for us to hear from the Ministry of Health this exciting news, as well as to hear from Minister Mahler of all the progress that we've been making over the last 8 months in the tourism sector. As you know, it accounts for 45% of our GDP, so it's huge. Huge, and so we have to continue on the progress, and it is only if we get vaccinated, if we adhere to the protocols, that we can actually continue to rebuild our economy. And so it's very important for us to understand that. And in the middle of all that, there is the police. We have a very important task, and that task is not to punish you. Trust me when I say we take no pleasure or no joy in punishing anybody. You have to look at the police department and officers as just doing their job, more like referees, and trying to protect you and save your lives. Because at the end of the day, even though we hear that in some states in the United States they are removing the requirement of wearing masks, I heard this morning, I was watching NBC, where the WHO is actually now going back and saying that they are encouraging people to wear masks. I think the CDC hasn't gotten around to that as yet, but certainly the WHO is realizing the importance of wearing masks. And it's one of the critical reasons why we as a country and we as a people have been excelling in our fight against COVID. We are looked upon all across the region as a great and shining example on how to fight COVID. Admittedly, over the last few months, as we relax the regulations, we see more people getting out, and certainly not intentionally, but are in breach of the protocols. And so this is a reminder, because as the minister said this morning, we have active cases, 234, and we are waiting for verification on the type of variant that is in the country. So this is very, very critical information that is being shared, and certainly it is time for us all to re-engage in the reinforcement. I can say that on behalf of the police department, over the last week, and again, I'm not happy to report these numbers, but 108 ticket violations were issued for not wearing your masks or social distancing. We had to issue summons to 2 establishments in the Orange Walk district. My apologies, PM. In Orange, there's no targeting, I promise you that. But we had to summon them for violating and for encouraging social gatherings at their premises. And so it is a reminder that the police department will be taking this aggressive approach. We've been reminding the public since June 8th because we've seen where these cases are starting to rise. But in addition to all of the protocols, which everybody is familiar with, I'm going to go over some of the additions, some of the amendments that will be made this coming Sunday in light of the increase in numbers. First and foremost, the curfew will continue in place. So there will be an extension of the curfew from Sunday through to Wednesday night. It will remain at 10 p.m., but there will be an adjustment in the curfew from Thursday to Saturday night. The new curfew will be 11 p.m. So it is just a reduction of 1 hour, but a very important reduction because we have seen where at these various establishments, restaurants, like the minister said under the guise, they're actually operating like bars. That is a critical hour where things get out of control and people start to party, which again is not allowed under these regulations. The primary reason we had agreed to extend it was to accommodate all of the tourist destinations so as to allow restaurants to have maybe 3 seatings for the night as opposed to 1 or 2, so that their patrons can get home, so that their employees can get home. So that was always the intention, because we are not encouraging parties, whether at home, whether at restaurants, or whether on the sea. Because as you know, some Belizeans have gotten creative and taken the party to the sea. And so we're aggressively pursuing that as well. So that is the adjustment that will come in terms of the curfew. And if you're wondering if we're just an isolated case, you could check around the region. The other day, Jamaica had curfew at 2 p.m. in the afternoon for a Sunday. Imagine that, you had to be inside your house at 2 p.m. And so again, while we want to continue the war against COVID, it's very important that each and every one of us continues to play our very vital role. We all have to take ownership of our actions. We have to be responsible and to ensure that there's no need to call in the referees, the police department. In terms of church services, as you know, last month we had agreed to extend church service to 2 hours. We are now cutting back to the 1 hour church service. And again, that is with a 50% capacity inside the church. We are also encouraging, and I believe we'll be putting it in the protocols, to cordon off every other pew to ensure that we get the 50% capacity. I know that Holy Redeemer is one of those churches that actually has every other pew cordoned off so that you're not allowed to sit in those pews. And we will encourage all other churches to do the same to ensure that there is that 50% capacity in accordance with the statutory instrument. In terms of restaurants, we will continue with the 75% capacity for outdoor dining. We will also continue with 50% for indoor dining, but, and here is the change, we will not be allowing dining inside a restaurant that does not have a free flow of air, that is not properly ventilated. And so You cannot have an air-conditioned restaurant per se. It has to be a free-flow ventilation indoor restaurant. So it is allowed to have 50%, but it has to be a free flow of air. In addition to that, when it comes to restaurants, we will also be reactivating the use of justices of the peace. If you recall, last year at Christmas time, we had requested of justices of the peace to go into these establishments, these supermarkets and these home stores to regulate the social distancing and to ensure people were wearing their masks inside these establishments. And we fared off pretty well. So I want to thank the justices of the peace for coming in big for us over the Christmas holidays. But we will be calling on them again to now come into the restaurants and other establishments so that we don't have a continuation of the partying atmosphere. And so what the justices of the peace will be doing is just, like I said, ensuring that everybody is seated at their table, that there's no dancing, that there's no going to the bar and hanging out and that sort of thing. And if there is any violation, then these justices of the peace, of course, will liaise with the Belize Police Department to have those individuals ticketed or, in the case of an establishment, charged if they are in breach of the regulations. With respect to BPOs, we've been seeing some increase in numbers at BPOs, and so we have decided that starting this Sunday, there will be a capacity limit of 50% inside the BPOs. So again, this is going to create more social distancing inside the BPOs. It's a very critical part of our economy, just like tourism, and so we want to ensure that we can continue to get the productivity and certainly rebounding our economy with these BPOs, but a lot of them will start to have to get their employees working out of home. This is a new initiative, and I like to refer to it as the Frontline Personnel Amendment to the legislation. Traditionally, we think of frontliners as police officers, soldiers, doctors, nurses. That is our traditional concept of frontliners. But what we have learned is that there are far more individuals actually on the front line serving the population, interacting with the population, and so we will be encouraging frontline personnel to get vaccinated. So the entire month of July, we are requesting the following groups to get vaccinated. And in the event they do not get vaccinated, then starting August 1st, these individuals will have to present a negative COVID test every 2 weeks. So we are not saying that you are mandated to get the vaccine. We're just encouraging you. There's enough vaccine for everybody. We're encouraging you to go out and get vaccinated. But at the same time, if you choose not to get vaccinated, for the health and well-being and safety of the rest of the population that you are interacting with, you'll be required to present a negative COVID test every 2 weeks starting in August. And so what are we talking about? Who are the additional frontline personnel? So it definitely includes doctors, nurses, police officers, military. It also includes our educational frontliners, so this will apply to teachers. It includes our economic frontliners, so we're talking about tour guides, even though I know the tour guide and tour operators have been getting vaccinated and they have actually the highest percentage of individuals vaccinated. It also includes restaurant employees, restaurant owners and employees. They will be asked to get vaccinated, as well as all of the casino workers. So these are the different types of groups that will be expected. In addition, we would also like to ask our spiritual frontliners. Pastors and priests, they also interact with a lot of members of the public. We will be asking them also to get vaccinated in the month of July. I know a lot of them already have, but for those that have not, we will be asking them to get vaccinated in the month of July. And so that, I believe, takes care of all of the provisions. Like I said, we will continue to monitor very closely as the numbers go up, and as we have established there is a variant. It's just not clear which variant as yet. The test will be coming in on Friday. But we all have to play our part in continuing to win the war against COVID. So I want to thank all of the frontliners. I want to thank all Belizeans for having done an exceptional job since December of last year. But we are being called upon now to certainly up the ante. And we need to get vaxxed before we relax. I do it in the reverse, but nonetheless. Thank you all so very much. Have a good afternoon.
I have to correct it because we have to get this slogan correct, guys. Before you relax, get vaxxed. Very simple and easy. We got this, don't worry. And don't worry, Minister, we won't have to be like Jamaica at 2 p.m. Everybody's enjoying their Sunday dinner then. We are not doing anything wrong. Our good Belizeans are inside, adhering to protocol and regulations. And so, we have our closing remarks that will be done by Honorable John Briceño, our Prime Minister of Belize, the Minister of Finance, Economic Development, and Investment. Can you get a round of applause, please?
Thank you very much. Like the Minister of Police, I asked permission to take off my mask. So one thing, TR Shine, one thing you have to worry. You don't have to worry about is that Kareem can't take away your job. Because he can't rhyme, like myself. But thank you everybody for being here this afternoon or this evening. This is something very, very important for us as a country. And certainly it is a milestone within the Ministry of Health, where we are now announcing that everybody over the age of 18 that, wants to, but should go out and get vaccinated. And this is very, very important for everybody to understand. I have a 17-year-old, my minister, he's going to be 18 in August. And I'm sure he would want to go and get vaccinated right now because he doesn't take off his mask at all. And sometimes I tell Andre, take off your mask. And he does not take off his mask, so we need to do more of that. One of the things that we said coming on when we were in opposition is that we were going to listen to the science. That's what we did, that as soon as we got into government, we tasked the Minister of Health to be able to tackle COVID, the spread of COVID, and to find ways how we can reduce the curve and to curtail the spread as best as we possibly can. And we allow then the professionals to deal with that. And I know the other day, I think it was Jules Vasquez was challenging me that we are not fully listening to the science. But we believe that once we have managed to at least have a fairly good control of the spread of COVID, we also believe now that we have to walk this thin line where we're looking at the health of the people and the health of the economy. And once we believe that we've managed to have some sort of control over the rapid spread of COVID, then we felt that we have to put people back to work. As a government, there's absolutely no way that we can continue borrowing money, millions of dollars, and to assist people that have lost their jobs. It's simply impossible. So we felt that now we need to find a way how we can get people back to work. And we're starting to see the signs of doing that we've, again, seems that we've been doing right. Some people would call it luck, blessed, hard work. You choose which word you want to describe us. But we've had key people in the different ministries. And certainly we had the Minister of Tourism, Anthony Mala, somebody that has worked in the tourism industry for many years and understood that if we can open up safely, we can get people to come back very quickly. And that's exactly, we're seeing the results of that. It was not only making sure that we can control the spread of COVID, but also that when our tourists come to visit or visitors come to Belize, that they can feel safe, that they know there's a protocol how to get to the airport or to the border and how to get from the airport to the hotel, and that the hotels have strict protocols to ensure that we can keep them safe. And thanks to that, today we're seeing now that Belize is recovering so much faster than anybody could have ever thought. As it is right now, we're almost at about 80% of where we were in 2019. And God willing, and say knock on wood, if we continue at this pace, by the end of the year, we're going to be 110% over 2019. That speaks volumes to not only the minister, but to the people that he has working in the Ministry of Tourism and also at BTB. And many would be thinking, but why give so much importance to the Ministry of Tourism? Well, it is because tourism represents about at least 40%, maybe as much as 45% of GDP. And when the tourists, they come, they have to eat. So they eat with vegetables, they eat with chicken, with pork, with eggs, with beef. So many of the products that our farmers are producing. So they themselves also start working and they start making money. And if they make money, then they could go to the store and to buy. And it has this effect. The people in the service industry, our tour guides, our tour operators that have been almost at zero for more than a year, are finally starting to work. And what is exciting about this is that also that the people at the Ministry of Tourism are also very serious of ensuring that we keep people safe all the time while they're here, ensuring that, saying that the people, the tour guides and the tour operators, they also have to get what? Vax, right? I can't tell you. Are they like you? I don't know about you, I got two left foot, so I can't dance either. But maybe you could dance better than me, so I would not argue over that one. But you have to get vax, you have to get vaccinated to be able to go back to work. And that is something that we should consider very serious as a country, that maybe we have to consider employers to tell their employees, if you want to come to work, you have to get vaccinated. If you want to work in my hotel, you have to get vaccinated. If you want to come and work in my business, you have to get vaccinated. Because maybe it's not about you, but it's about the people around you. So if you don't care about you, well, let's care about the people around us. And that is why it's so important for us to get vaccinated. In Cabinet, we spoke about it a bit, and I hope I'm not speaking out of turn here, where we're talking about starting to, considering very serious to ensure that all our frontline workers in government, that they must get vaccinated. That the BDF, the police, immigration officers, customs officers, and all of our employees that have to deal with the public must get vaccinated. We're not there yet, but we probably may have to get there if we do not see that the numbers are going up quickly enough within the government service. What our frontline workers have done, the doctors and the nurses, our health workers, especially in 2020, when we had the lockdown, I mean, it's nothing short of heroic what they did. Because many times when we just started with the virus coming to Belize, we had no idea how this virus is going to be reacting to us, to our bodies, and how it's going to be spreading. Many of these doctors and nurses and people working in hospitals, in some instances, weeks went before they could go back to their homes. And this is something that no amount of money can pay back. And that is why we in Cabinet, we have been discussing that we must do something for us to be able to give them some sort of recognition that would go beyond 2020 or 2021 or 2022, but something that they can keep forever and ever with them. That is why for the September celebrations on the awards night, we are going to have a special award for that night, an award that we're calling the Special COVID Awards. We are going to give a special recognition to all of our frontline workers. Now, we can't expect all of them to be there on that night, but we want to organize it in such a way that all of our frontline workers is going to get, I'm not sure, I think it's going to be a medal, a special medal that is only going to be given once in a lifetime, and is going to be for all of those people that put their life on the line last year to protect the rest of us. That's a small way of what we can show appreciation to them. So I want to thank also the media. The media has been very instrumental in getting the word out about COVID and how important it is for us to be able to protect ourselves. We still can't run away from this. Ladies and gentlemen, keep your distance, wash your hands, wear a mask, and know, how is it? Before you relax, get vaxxed. Thank you so much, everyone.
Thank you so much, Prime Minister. Now, we don't have an award ceremony right now presently for our head table and for our ambassadors and so forth. However, we do have tokens of appreciation that we want to give out. So I'm going to ask you guys to help me with that. They're going to go around and give out the token of appreciation to our head table. Oh, and so we want to take pictures too, because you know how we love a good picture. So we're going to move this. So while they're doing that, I want us all to repeat this slogan, because if nothing else we take away from here, what is the slogan, everyone? What? I did not hear it clearly. Okay, I heard someone say, so before you get relaxed, and I was like, come on, man, we got to get this right the first time. And so we're going to go around. And feel free to open. You know, sometimes you're going to get a gift you don't want to open and make people see what they're in there. We want you guys to open it up to show everyone. So I'm going to ask Minister Mahler, can you please come up? It's picture time. It's picture time. Smile through the mask. Minister Musa?
Extra large.
Okay, and now, special, different one. Minister Shabat and our PM will come up for this one. 2 for the price of 1. See, I like how PM showed his shirt, man. You guys did not show your shirt. You have to let everyone see that you're full, you know, in full support. And Minister, sorry, I know you sat down and the seat looks very comfortable, but I'll ask you to get up one more time because we're going to give out to our ambassadors and our partners as well. And so we want you to be in that picture along with our CEO. We need to see your beautiful faces indirectly through the mask, smile through the mask. My mom says smiles. And so we're going to ask Paho. So Dr. Noreen, could you come? Yes. And I know Miss Parker isn't here right now, but Stephanie, since you're representing UNICEF, could you please come up? I see you rolling your eyes, but I know that means love. Minister, you're not getting in these pictures, you know. I see you're hiding from the camera. I see that. And so, yes, social distancing, not for the pictures, though, just for the pictures. And we have BTL, Mr. Mark Izaraga. Okay, now we'll have our ambassadors. Ambassador of Taiwan to Belize, His Excellency David Kwan Chau. And Minister Dolores, we see you there too as well, and we have for you as well too. Yes, no, don't get upset because now you have to wear the t-shirt. You have to. So Minister Dolores. So we're going to look out to see these pictures of them wearing these t-shirts, right? And saying the slogan, before you relax, get vax. I'm saying it over again because Minister Musa messed it up the first time, so we have to make sure we don't mess it up again. And so we'll call an ambassador to Panama, from Panama, Her Excellency Marta Boza. And then now we have the Ambassador of Mexico, Her Excellency Marta Rivas. See, this is what we're talking about, guys. Take out the shirt. Show them what you got. From the U.S. Embassy, the Acting Deputy Chief of Mission, Andrea de Amar. And then, of course, the Council of Guatemala to Belize, Bayron Morales. It's like traffic you have to go through, right? Just to reach. You guys are finished. Your job is done. Yes, we appreciate the pictures and the smiles and everything. And now for one of the moments I'm sure the media has been waiting for. We have time for questions. Now, I'm going to be very, very strict about this, everyone, because I know we're so anxious about it. We'll be having a microphone. It's right, as you can see, there's a nice microphone, semi-middle of the room, something like that. And this is how it's going to go, media houses, right? Listen very clearly and carefully. You're allowed 2 questions, not 2.5, not 2 3/4, not that. 2 questions per media house. When you go on the microphone, you will repeat your name and your media house, and then you can proceed to ask your questions. Again, two, número dos, questions, right? So, please proceed. You can now ask your questions, and the head table will be open now to answer.
I'm hoping it's 2 per minister.
No, 2 per table, so 2 only.
Okay, well, fortunately for everybody at the head table, both of my questions are directed to Minister Shabat. Unfortunately for you. Well, the first one is why launch this campaign 3 months after the vaccinations were available? I believe they're available back in March that we started. This obviously the first campaign must have failed, because if it wasn't broken, you wouldn't have fixed it.
Yeah, I guess you're from Channel 7. Yes,
course.
well, then there's the question. But as I had explained when we started, if you had listened keenly, when we started, we got in 1,000 vaccines in March, which was followed by 25,000 and then 36,000. And so we had to ensure that the initial shipment of vaccines were dedicated to our frontline workers, our healthcare workers, and to the most vulnerable in our society. A couple of weeks ago, through the courtesy of the government and people of Mexico, we were able to get 100,000 vaccines. And so with that gift, we are now able to open up to the entire country, and we felt it was now appropriate to launch that by having this media campaign. Thank you very much.
I was 3, I'm the 1A, the 1B. Some of these things that are, some of these stuff that are being offered, the billboards, the bumper stickers going to the different communities, why wasn't the ministry able to do this from the get-go? Because even though we wanted to stick to the phases, we know that people outside the phases were still getting vaccinated, and it would have been, everybody wanted the numbers to go up. So wouldn't doing this earlier would have made those numbers go up faster?
Well, the numbers could not go up faster because we did not have sufficient vaccines for everybody, Courtney. And so, again, as I repeated, we got the vaccines in stages, and how we got them into arms. And again, we had to reserve them initially for our healthcare workers who are at the front line, our police, and then to the most vulnerable of our society. But you know, thankfully, God is great, and we have good neighbors, we have good friends who have helped us not only with vaccine, but with also the cold storage, with the syringes to be able to get it into arms. And so, despite your characterization of the campaign, I can tell you with 112,000 Belizeans having at least 1 dose, in my book, that is a success. Thank you very much.
Now, second question, I promise this is the final.
No, this is the last question. I thank you
final
so
question.
much.
No.
But we're going to have the next media house. Please take the microphone. Thank you.
Hi, good afternoon. Andrea Polanco, Channel 5. My question is directed to Minister Michelle Shabat. Minister, what are you able to tell us about where this variant was detected? What are the health experts locally saying in terms of what they believe, which of the variants this is? And this is one question related to the same topic, has contact tracing begun for these?
Yes, so let me start from the back going forward. Every time we have a new case identified as positive, contact tracing begins immediately. And so I can assure you that that has been ongoing. In terms of where the variants were detected, the local experts believe that it could be the Delta strain, but it is only a belief. As I said before, the swabs have been sent to Baylor University, Baylor College, and once they're able to confirm, then we'll be able to come back to the Belizean public and confirm the variant that has been detected. It has been detected in several parts of the country. One person was detected from Ladyville. We have detected it in the south, in the Stann Creek district, and also in the Orange Walk district.
Okay, the contact tracing is at the ground, right?
Yes, it is.
Okay, great. My second question, perhaps I would like if Mr. Mala can chime in, but you as well, Minister, it's twofold. The suspicion is, right now we don't know which variant it is. The suspicion is that it's the Delta variant. The World Health Organization, I believe, termed the Delta variant to be one of the fittest and fastest in that it's highly transmissible. Now, we know that in about a week time or so, is it, that cruise is going to return to Belize. Does this change anything in terms of opening up for tourists in the country? And Minister, in terms of if it's Delta or whichever variant we have here, are we prepared? Is our health system prepared for this? Because it's highly transmissible. It means that it will be moving from person to person. It means that we'll be seeing more persons sick, and it will overwhelm our already fragile health system. So if I can get a response from Minister Mala and Minister Shabat. Thank you.
Go first. Go. Yeah. So again, we have had the experience over the past few months dealing with this virus since we came into government, and our health systems, our hospitals are prepared. We are ready to combat whichever variant it is we are experiencing right now. Clearly, the solution is getting vaccinated. We cannot overemphasize how important that is. The AstraZeneca vaccine we currently have in country is effective for this variant, if that is in fact the variant we have. And so I want to again reiterate and encourage everyone who has not yet gotten vaccinated to please go out and get vaccinated at your earliest. Minister?
With regards to the tourism component of it, the cruise lines will only allow most of them, Royal Caribbean, Norwegian, 100% vaccinated people to go on their cruises. Carnival is working with about 95%. Only a small portion of cruisers will be allowed on board, and they don't have to be vaccinated, and that's for medical reasons, children, and for religious reasons. So, for example, Carnival starts July 7. We're expecting about 2,500, maybe 3,000 passengers on that ship. They're working with 60%. All the people who aren't vaccinated will be in their own quarters. They will have their own buffet. They will have their own tender. They will have their own tours separate from the other people. And I believe that the CDC wouldn't have allowed cruising to start if they didn't feel that they could do it safely. Now, take into consideration, all through 2020, cruising was happening in Asia and other parts of the world, and they've done a pretty good job in terms of not having any spread caused by the activity. We have our own protocols in country, and they're stringent, and the minute we see anything suspicious, then that person has to go back on the ship.
Okay, the next media host.
Yes, Aaron Humes, Breaking Belize News. Is it possible if I can just add one clarification to my two questions? One brief clarification, and it's directed to the Minister of Home Affairs. The end of the curfew, I think you mentioned it will start at 10, Sunday to Wednesday, 11, thereafter, does it end, what time? What time does it end?
It starts this coming Sunday, and so for the remainder of this week, the curfew will still be for Thursday to Saturday. It will still be at midnight. But starting Sunday, it is going to end, like I said, 10 p.m. And that will start again, I believe, 4 a.m., 10 p.m. to 4 a.m. The following morning. And then on Thursday, it will end at 11 p.m. It will start, the curfew at 11 p.m.
All right. First question now, and this is from one of our readers who asked me specifically to ask the Prime Minister this. So I'm directing this to you, Prime Minister. You mentioned just now that we would have the Special COVID Award during the tribute to Belizean Patriots as part of the September celebrations. Generally speaking, what will the September celebrations look like in terms of so many outdoor activities where people will be gathering and that sort of thing?
Sorry to break the news, but it's not going to be like 2019. It's going to be more like 2020. Let's put it this way. If you want to have a fairly decent, regular Christmas, get vaccinated. And we will not get enough people vaccinated by September. So the September celebrations are not going to be like, there are times they have to be
So more like
limited.
last year?
A little bit less, a little less stringent, But it's still not going to be that. There's going to be no carnival, there's going to be no parades, and there are going to be some activities, but again, with the social distancing and the mask and so forth.
Okay, I don't know if anybody else wants to jump in on that one.
There's nothing else to add.
Okay. All right, next question then. Second question, last one. For the Minister of Health, this vaccination campaign is going to involve some overtime, I imagine, for doctors and nurses. And of course, we're also hoping that that there's no more cases, or that the cases are kept to a minimum. Is the ministry addressing issues of overtime and ensuring that health workers are not burned out or stressed out by this, what they will face this summer?
We don't believe that they will be. I can tell you that the ministry just hired 25 more vaccinators who have been deployed throughout the country, and that is really to alleviate some of the healthcare workers who have been constantly battling this virus. So we're very much aware of the constraints and the hardship on some of them, and so we've taken the step to hire additional vaccinators who will be helping in this campaign. Thank you.
Good afternoon, Marcella Maya from News. I'd want to preface my questions by saying that we would want interviews after, due to the very restrictive number of questions, especially at a time when you're announcing that there's a variant of the COVID virus present in Belize, and that will heighten the concern of the population. So my first question is, now that we can expect an increase in numbers, can we get an update on how many COVID beds we have countrywide? I imagine, and I know it has in fact been increasing over time, and also how many ventilators we have available. This is all as it relates to preparedness, and ties into the question of whether Baja has now been operationalized to provide PCR testing.
Let me answer by starting again. Baja has been helping us with the testing and the sampling, so they are in operation. In terms of the exact number of beds and ventilators, I don't have those numbers with me, but I'd be happy to share them with you later on, probably through an email or a WhatsApp.
Yes, because I note that you don't have a technical officer present. The second question is, if we have not yet, is it the intention of the government to conduct a survey on anti-vaxxers for us to know how many people we need to target and why we need to target them, to understand why they're avoiding taking the vaccine and how we can bring them across?
Well, that's a great idea, Marisol, but I can tell you that our community health workers who go out into the villages and into the areas talk to our people, and they get an understanding from the populace as to why they are resisting the vaccine. And so we have some of that information already. Thank you.
Good afternoon, Head Table. Hipólito Novello from Love News. How did we get here, and where does the blame lie? And I know you would say there's no point in terms of playing the blame game, but faults must be identified for us to come up with effective solutions. I'm asking, is it the public's fault for continued failure to follow the COVID rules, the authorities' fault for not enforcing the regulations, or is it the ministry's fault for a failed education campaign?
Directed at me, I guess. But certainly, Hipólito, if we are to go down that route of blame game, then we have to look at every single country in the world and then say that all of those countries have incompetent police officers, incompetent nurses, incompetent doctors. This virus is unpredictable. And so there's no use in blaming anybody. Everybody has a part to play. And like I said in my remarks, It is important for every single person to take ownership of this issue. It is not limited to just police officers. They actually have a job to do to fight crime. And of course, we are on the resource, on the man, on the staff. We need new vehicles. There's a lot of things to complain of, but there is no use complaining. At the end of the day, this is a serious, pressing issue, and we all have to play our part in order for us to win against COVID.
Minister Shabata, the education campaign?
Polito, like I said before, with 112,000 people vaccinated, in my book, that is a success.
People on social media who are following the stream are giving their mixed reviews in terms of that commercial for the national campaign. Some people are calling it reckless for an idea of a vaccinated party, because one might say that it may contribute to the increase of COVID cases, because you're giving out the idea that because I am fully vaccinated, I may host a party. But as mentioned earlier in the press conference, being fully vaccinated does not mean that you're immune to the virus, and doesn't mean that you can't transmit the virus. Are you considering on rearranging that commercial, or because it sends the wrong message?
Well, the idea behind the commercial is we wanted to reach out to the young people who we feel are the ones who are out there and partying and so on. And so the idea was to try to sensitize them to the importance of getting vaccinated. And that is the whole concept behind it. As you saw, everybody had to present a vaccination card, and on every different site that the camera panned in on, it reflected a vaccination card. And so that was the concept behind it, Hipólito.
Cost of this campaign?
Sorry?
The cost of this campaign, was that on the budget before, or another supplementary appropriation would be?
Part of our COVID budget, which
Okay.
was allocated in April.
Okay.
It was.
Okay.
Okay. Thank you very much.
And I think just like that, we're finished with our question segment. Lovely that we stuck to the 2 and did a little bit 2.1, but it's okay. And with that, we come to the end of our launch. We thank you so much for attending. We thank our partners, PAHO, European Union, BTB, and BTL, every invited guest, all our ambassadors. Thank you so much for taking time to be here. We close off, and of course, with our slogan, before you relax, get vax. You know what to do.